Erectile dysfunction, often called ED, is one of the most common men's health issues worldwide. It affects millions of men and can impact not just physical intimacy, but also confidence, self-esteem, and relationships. At the same time, testosterone, the primary male sex hormone, plays a critical role in energy, libido, and sexual performance. So, a natural question arises. Is low testosterone linked to erectile dysfunction? The answer isn't simple. While testosterone does influence sexual function, ED is a complex condition with many causes. In this video, we'll explore the role testosterone plays in erections, how low levels may contribute to ED, and what other factors could be involved. We'll also look at treatment options, from medical therapy to lifestyle changes, so you have a complete understanding of this important health topic. Testosterone is the primary male sex hormone, produced mainly in the testes under the direction of the brain, specifically the hypothalamus and pituitary gland. Together, they form what's called the hypothalamic pituitary testicular axis, or HPT axis, which constantly regulates hormone levels. Testosterone plays a central role in many aspects of health. It stimulates muscle growth and helps maintain lean body mass. It supports bone density and strength, and it fuels the production of red blood cells that carry oxygen throughout the body. Most importantly for this discussion, it also influences sexual function. Inside the male body, testosterone is critical for maintaining libido and preparing the tissues of the penis to respond properly to sexual stimulation. Without adequate testosterone, interest in sex may fade, and erectile tissue may not respond as efficiently. This is why men with very low testosterone often report reduced sexual desire and weaker erections. However, testosterone is only one piece of the larger erectile puzzle. Achieving and sustaining an erection requires a complex interaction of systems. Hormones must be balanced, blood vessels must deliver strong blood flow, nerves must carry signals from the brain, and the mind itself must be free from stress or anxiety. Even with normal testosterone levels, erectile dysfunction can still occur if circulation is poor, if diabetes or nerve damage is present, or if psychological barriers are in play. In short, testosterone is essential, but it is not the sole factor behind erectile function. Erectile dysfunction, often called ED, is defined as the persistent inability to achieve or maintain an erection firm enough for sexual intercourse. It's important to note that almost every man may experience occasional difficulties. Stress at work, a poor night's sleep, or drinking too much alcohol can all cause temporary issues. But when the problem becomes consistent and lasts for several months, it is considered erectile dysfunction and usually requires medical evaluation. ED is far more common than many people think. It affects millions of men worldwide, especially as they age. But it can also occur in younger men when health or lifestyle factors are involved. Beyond the physical challenges, ED often impacts self-confidence, emotional well-being, and intimate relationships. The causes of erectile dysfunction are complex and often overlapping. Some are vascular, meaning the blood vessels that supply the penis are narrowed or blocked, which reduces blood flow. Others are neurological, such as nerve damage from diabetes, spinal injury, or certain surgeries. ED can also be psychological, triggered by stress, anxiety, depression, or relationship conflicts. And of course, there are hormonal causes, including low testosterone, which may reduce sexual desire and weaken erectile response. Because ED can have so many possible roots, doctors usually look at the whole picture: medical history, lifestyle, hormone levels, and mental health before recommending treatment. In short, ED is not just a performance issue. It's a medical condition with many layers, and understanding those layers is the key to effective treatment. So how exactly are low testosterone and erectile dysfunction connected? The truth is that the relationship is real, but not straightforward. Testosterone has a clear role in sexual health. It fuels libido, or sexual desire, and supports the proper function of erectile tissue. Men with very low testosterone often report a lack of interest in sex, reduced morning erections, and weaker responses to sexual stimulation. In this way, low testosterone can contribute indirectly to erectile dysfunction by lowering sexual drive and reducing the body's readiness for intimacy. But here's the important point. Testosterone is not the main driver of an erection. Erections are primarily a vascular event, meaning they rely on healthy blood flow into the penis. That process is controlled by nitric oxide, a molecule that relaxes blood vessels so they can fill with blood. Conditions like diabetes, high blood pressure, obesity, or cardiovascular disease can interfere with this system and cause ED, even if testosterone levels are perfectly normal. Still, research shows that when testosterone levels are severely low, the erectile tissues themselves may not function properly. Testosterone influences the sensitivity of penile tissue to nitric oxide and helps maintain its structure. Without enough testosterone, blood vessels may not dilate effectively, making erections weaker or less sustainable. It's also worth noting that low testosterone and ED often share the same risk factors. Obesity, diabetes, smoking, and chronic illness can reduce testosterone production while also damaging blood vessels. This makes it harder to separate cause from effect. Sometimes ED and low T are not directly linked, but both are symptoms of the same underlying health issues. In clinical practice, doctors find that restoring testosterone levels in men with low T often improves the libido and may modestly enhance erectile function. However, testosterone therapy alone is usually not enough to fully resolve ED if vascular or neurological problems are present. That's why treatment often combines hormonal support with other approaches, such as medications to improve blood flow. So, the link is clear. Low testosterone can worsen ED, mainly by reducing sexual desire and weakening erectile tissue. But most cases of ED have multiple contributing factors, with testosterone being only one part of a much bigger picture. While testosterone plays an important role, most cases of erectile dysfunction are linked to other health conditions. Understanding these causes is crucial because treating ED often means addressing the root problem, not just the symptoms. One of the most common causes is cardiovascular disease. Erections depend on healthy blood vessels that can deliver enough blood to the penis. If arteries are narrowed or hardened by conditions like high cholesterol, hypertension, or atherosclerosis, blood flow is restricted. In fact, ED sometimes an early warning sign of heart disease. Another major cause is diabetes. High blood sugar damages both blood vessels and the nerves that trigger erections. Men with diabetes are 2 to 3 times more likely to develop ED compared to those without it. Obesity is also strongly linked. Extra body fat disrupts hormone balance, lowers testosterone levels, and contributes to poor circulation, all of which increase the risk of ED. Certain medications can interfere with erections, including drugs for high blood pressure, depression, or anxiety. This doesn't mean men should stop taking them, but they should talk with a doctor if side effects appear. Finally, psychological factors play a big role. Stress, anxiety, depression, or relationship issues can make arousal difficult, even if physical health is normal. Performance anxiety alone can create a cycle where fear of failure leads to ongoing ED. In short, while low testosterone can be a factor, erectile dysfunction is usually multifactorial, involving circulation, nerves, hormones, and even mental health. That's why comprehensive evaluation is the best path to effective treatment. The good news is that erectile dysfunction is highly treatable, and many men are able to regain sexual function once the underlying causes are addressed. Treatment typically starts with identifying what's driving the problem, whether it's hormonal, vascular, neurological, or psychological. For men with confirmed low testosterone, testosterone replacement therapy, TRT, can sometimes help. By restoring hormone levels, TRT may improve libido and slightly enhance erectile quality. However, TRT alone is rarely enough to solve ED if poor circulation or nerve damage are also involved. The most common medical treatment for ED is oral medications like Viagra, sildenafil, or Cialis, tadalafil. These drugs work by increasing nitric oxide activity, which relaxes blood vessels and allows more blood to flow into the penis. They don't create desire, but they make it easier for the body to respond to arousal signals. Beyond medication, lifestyle changes are powerful. Losing excess weight, exercising regularly, eating a balanced diet, quitting smoking, and reducing alcohol intake all improve both testosterone levels and erectile function. Adequate sleep and stress management are also essential, since poor rest and chronic anxiety directly affect performance. For men whose ED is linked to stress or relationship issues, psychological therapy can make a huge difference. Counseling, stress reduction techniques, or couples therapy can break the cycle of anxiety and restore confidence. Finally, in more severe cases, there are additional options: vacuum erection devices, penile injections, and even surgical implants. These treatments are usually considered when other therapies don't work. The key message is this: ED is not a dead end. With proper diagnosis, a combination of medical treatments and lifestyle improvements, most men can significantly improve their condition and regain control over their sexual health. So, what should we take away from this discussion? First, testosterone absolutely plays a role in sexual health. When levels are too low, men may lose desire and experience weaker erections. But erectile dysfunction is usually multifactorial. Blood flow, nerve function, mental health, and lifestyle often matter just as much, sometimes even more than hormone levels. Second, treatment is not one size fits all. For some men, restoring testosterone may help. For others, addressing cardiovascular risk, improving lifestyle habits, or managing stress and anxiety can make the biggest difference. Often the best results come from combining approaches. Finally, ED should not be seen as just a performance problem. It's a potential signal of broader health concerns, like heart disease or diabetes. Taking it seriously and seeking help is not only good for sexual well-being, but also for overall health and longevity. In conclusion, low testosterone and erectile dysfunction are linked, but not in a simple one-to-one way. Testosterone fuels desire and supports healthy erectile tissue, but erections themselves depend heavily on blood flow, nerve function, and mental state. That's why some men with normal testosterone still struggle with ED, while others with low testosterone may notice improvements once hormone levels are corrected. If you're dealing with persistent erectile difficulties, don't ignore them or assume it's just aging. ED can be an early sign of underlying health problems, and effective treatments are available. The first step is always proper medical evaluation, checking hormones, circulation, and overall health. Remember, a healthy sex life is part of overall well-being. Taking care of your body, mind, and hormones together is the best way to restore confidence and vitality. If this video helped you, please like, comment, and subscribe for more science-based men's health insights.